Welcome to another Rio Rancho Public Schools Health Department training. This training will educate you on how to care for students who have seizures. You can use the buttons at the bottom of the screen to control the speed of the training and to review the slides if you need to. There will be a short quiz at the end. Be sure to go all the way through the quiz so the training doesn't score you as incomplete. A seizure is a brief discharge of electrical activity which alters any or all of the following: movement, sensation, behavior, and awareness. A seizure disorder is characterized by a chronic tendency to have recurrent seizures and is known as epilepsy. There are two classifications of seizures. Idiopathic epilepsy means we do not know the origin of the seizure and the person has no other signs of neurological illness. Symptomatic epilepsy means the seizures are a result of a known illness or injury. The cause of epilepsy is unknown in about 70% of the population. The remaining 30% of the population with epilepsy have an identified cause of medical problems or syndrome situation-related epilepsy. The medical causes of epilepsy are low blood sugar, infection, head injury, poisoning, drug overdose, febrile or high fevers occurring in children less than 5 years old, anything that causes a sudden lack of oxygen to the brain, or lastly, extreme lack of sleep occurring mostly in adolescent years. Or they may be the result of a syndrome and situation-related epilepsy. The main categories of seizures are partial and generalized. Partial seizures are localized in one side of the brain and can evolve into generalized seizures. Partial seizures involve motor and sensory symptoms, involuntary activity, and altered states of consciousness. Full awareness is maintained. Isolated twitching of arms, face, and legs may be seen. The child may experience tingling, weakness, sounds, smells, taste, nausea, visual distortions, feel anxious, feel fearful, or have anxiety they can't explain. These seizures usually last less than 1 minute and can be confused with acting out, mystical experience, or psychosomatic illness. Complex partial or partial seizures that involve impairment of consciousness where the person cannot respond or carry out commands of purposeful movements. These seizures often begin with a blank stare, repetitive purposeless movement, aimless walking, lip smacking, or nonsensical speech. They last 1 to 3 minutes and are followed by a headache, tiredness, or nausea. This seizure can be confused with drunkenness or drug abuse. Generalized seizures occur when seizure activity affects both sides of the brain at one time. They can be convulsive or non-convulsive, and the most common types are tonic-clonic, absent seizures, and myoclonic. What do these seizures look like? Tonic or grand mal seizures are probably the type of seizure most people think about when they think of epilepsy. You will see the person lose consciousness followed by jerking movements. Absent seizures, also known as petit mal, are difficult to recognize. Most often they occur in children ages 5 to 12 and stop in adolescence. The loss of consciousness is brief and may go unnoticed as it may only last about 10 seconds. Myoclonic seizures are also difficult to detect. They are very brief and involve muscle contractions that are often confused with tics. Seizures may be triggered by flashing lights, hyperventilation, missed or late medication, stress, lack of sleep, illness, alcohol or drug use, overexertion, poor diet, and head injury. All types of seizures can affect learning, especially short-term memory. You may need to review material with a student that has just had a seizure. The most common side effects of seizure medication are drowsiness, inattention, concentration difficulties, and behavior changes. Low self-esteem is common with students with epilepsy, but difficulties in school are not always related to epilepsy. You need to know that most seizures are not medical emergencies. Students are usually unaware they are having a seizure and will not remember what happened. A person having a seizure cannot swallow their tongue. Do not put anything in the mouth of someone having a seizure. Be sure to stay calm, and after the seizure, support the student by encouraging positive peer interaction. If you have a student with seizures, make a plan for the classroom. Your school nurse will develop a health management plan which will detail actions for you to take in the event your student experiences a seizure. The health management plan should contain elements such as stay calm during a seizure episode. Place the child on the ground or floor in a safe area. Protect the student's head from hitting anything during a seizure. Remove students from the classroom and send someone to get the nurse. Remove nearby objects. Loosen clothing around the neck or head. Do not place anything in the mouth and do not attempt to restrain movements. Once the seizure movements have ended, roll the child onto his or her side. Document the seizure activity on a seizure log if required by the health management plan. There are many things you can do to support your student with epilepsy. Work closely with your school nurse and review the student's health management plan and action plan. Be sure to know what medications the child is taking and their possible side effects. Encourage the student to participate without limitations unless otherwise directed by their health management plan. These students should be encouraged to be as independent as possible in all activities and to be included in as many activities as they can. Lastly, communicate with parents and your school nurse about any changes in behavior or increase or changes in seizure activity. Your school nurse will develop a seizure action plan. This plan will help you handle your student's seizure emergency. In addition, you may be asked to keep a seizure log where you record the start and stop time of the seizure and what it looked like. This log is generally shared with the school nurse, the student's parents, and/or the healthcare provider. Your student may have a medication prescribed that will help break a seizure that will not stop on its own. This medication is called Diastat. It is administered into the rectum. Your school nurse will provide additional training to unlicensed personnel on how and when to administer this medication. Some children will be prescribed a special diet to help eliminate or minimize seizures. This diet is a medical treatment, not a fad diet, and is known as a ketogenic diet. It is primarily used to treat severe childhood epilepsy that has not responded to standard anti-seizure drugs. It is high in fat, low in carbohydrate and protein. No sugar is allowed. This diet requires a strong commitment from family and school caregivers, as no cheating is allowed. Finally, some students have a device implanted just under the skin which delivers intermittent electrical stimulation to the vagus nerve. It is used to treat partial seizures when medication is not effective. A special magnet is used to activate the device. Your school nurse will provide additional education and training if your student has one of these devices implanted. In the absence of your school nurse or health assistant, it will be up to you to call 911 in the following situations. There is no medical history of seizures, and this is the first seizure a child has had. The seizure lasts longer than 5 minutes, in which case you may see difficulty breathing or turning blue in color. The child has sustained a head injury, is pregnant, or has diabetes. The seizure occurs underwater. Normal breathing does not resume, or the parents have requested an ambulance. It may not be necessary to call 911 for a student experiencing a seizure. If the student is breathing normally and the seizure lasts just a few minutes, wait until the seizure has subsided and refer to the student's health management plan for appropriate steps to take for the student's care. If the student has been prescribed Diastat, only trained personnel can administer this medication. Follow the instructions on the student's health management plan. And if the student has a vagus nerve stimulator, follow the health management plan. Following the seizure, the child will probably fall into a deep sleep called the postictal period. This is normal. The child may be sleepy, lethargic, or out of it for a period of time immediately following the seizure. Do not try to give the child food or drink until the child is awake and alert. Now it's time for a short quiz. Be sure to go all the way through the quiz and not exit in the middle, or the system will score you as incomplete and not let you retake the quiz.